Good morning. My name is Celeste Howard Bork, and welcome to my crisis management project. Here we have my first patient is a 45-year-old married for 15 years with two children. He has a history of major depressive disorder and pornography addiction, which has been dealt with through therapy. This addiction had caused him some trouble in his marriage for about the past 5 years now, and things have been going well in the marriage. And the patient denied looking at porn. Now, his major depressive symptoms started in his 20s and has been well managed with citalopram, 20 milligrams daily. He comes into my office today being visibly upset, reporting that his wife has been cheating on him for the past 2 years. And that was basically in brief. So what the appropriate course of treatment for this patient, what I would do, he has one, we know he has a history of major depressive disorder. Two, he has a pornography addiction. And all this will depend on the type and degree of his personality disorder as well as his current circumstances. So my first step for this patient would be to ask about his past and family history of suicide ideation in order to make a determination whether he has suicide ideation as well as its content and duration. Then I would ask this first because suicidal thoughts can be either one active or passive, and this is would be depending on the patient's response to the questions. So if suicidal thoughts are present today, it would be important to determine whether they are new and how he is dealing with current problems that may be chronic. Also, I would encourage him to talk openly and encourage him to be honest with his friends and that how much he is missing his children. Next, I would inquire about his expectations about death, need to escape a painful physical or psychological situation, or his thoughts about death, need to, or psychological situation, or his thoughts of harming others first before harming himself. Therefore, it is important to evaluate how lethal his plan may be if this is present. Additionally, I would encourage a safety plan should be discussed after his evaluation, including identifying warning signs, securing or removing dangerous agents, reviewing personal and interpersonal coping mechanisms, and finding professional available help. So, in order to provide psychiatric services to this patient at risk for suicide, an evaluation needs to be conducted. From this evaluation, a level of care would be determined. When someone is having a mental health crisis, such as this patient, they could be feeling suicidal, one, experiencing severe anxiety, two, reacting to a life problem or having a psychotic episode, or four, a combination of all these symptoms. Therefore, I would also encourage my patient to take an active role in his mental health recovery, such as get out of the house as well to visit family and friends and try to enjoy a healthy lifestyle as much as possible. All right. And then here I come to patient number two. So my second patient is a 19-year-old married female with a 2-month-old baby for her fourth visit. Today, she presents dressed more provocatively than I've ever seen her before. Her makeup is heavier than usual as well. The baby is actually in a carrier and sleeping, just fast asleep. No issues there. The patient starts discussing a video series on aliens she has been watching, and her speech is rapid, loud, and tangible. She makes several looseness of associations between the video series and her baby. So, from her rambling, it sounds as if she believes that the baby is an alien and she needs to take it to the desert and leave it in the mountain for the aliens to come and retrieve the baby. She also reports making plans to go camping with the baby and her husband this weekend. Excuse me. Her husband is present and reports that she's been acting different for a couple of weeks, has never behaved like this before, and he is scared to leave her alone with the baby. And then the patient interjects that she knows the secret to the world peace, and giving their baby to the aliens will accomplish this. So I will say for my first step for this patient would be to initiate a psychiatric interview. I will ask her and her husband questions to find out how her situation contributes to her psychosis. The abnormal and strange behavior of the patient may be harmful for her and the baby as well. And that's pretty much goes without saying. I think I have to ask more questions for the better understanding of onset of her abnormal behavior as well. I will try my best to build a good relationship with the patient and her husband and encourage healthy behaviors so I can recognize and treat early symptoms. In the patient's initial psychiatric interview, several important aspects are considered, including her history of her current illness, her psychiatric history, past medical history, developmental history, substance abuse history, and family history of mental illness. Now, consequently, it is crucial to conduct a comprehensive mental health examination, a general physical examination, and to collect the findings from her and her husband's psychiatric interview. Also, I would include lab testings such as complete blood count, chemistry panel, electrocardiogram, urinalysis with reflex culture, drug screening, thyroid serum, so TSH. Sorry, I'm having rambling problems this morning. Vitamin B12, ESR, and anti-nuclear antibodies. These tests are important because they can actually rule out some of the more common medical etiologies that are associated with delirium and psychosis. So, antipsychotic medications are usually recommended as a first treatment for psychosis, even if the cause of the psychosis is unknown. Just like in this case, we're not exactly sure why she has psychosis and acting different per reports from her husband. Therefore, she will be described a second generation antipsychotic such as risperidone, quintonapine, or alazapine. And thank you so much for my morning presentation on my crisis management. Thank you so much. Have a great day.